like you said, there's inner beauty, there's outward beauty, there's happiness, there's peace. And I feel like that all kind of plays a role in beauty. Confidence, sometimes a smile is part of beauty. And we are here to elevate your smile. But I think it's a lot of things.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Diana Grace Lin, an oral and maxillofacial surgeon, entrepreneur, and founder of Elevate Oral Surgery Group in Raleigh, North Carolina. Known for combining advanced surgical expertise with a modern patient-centered approach, she has built a practice focused on elevating the experience of oral surgery through clinical excellence, innovation, and compassionate care. Her work and perspective on dental implants and wisdom teeth has been featured on American Health Front on ABC 11, highlighting her commitment to advancing patient care and improving access to high-quality surgical treatments. Beyond the operating room, Dr. Lin is an active leader in organized dentistry and community service, serving as program chair for both the Raleigh-Wake County Dental Society and the Wakefield Rotary Club. She has also participated in multiple international humanitarian missions, bringing surgical care to underserved communities around the world. So, Dr. Lin, welcome and glad to have you here.
Thank you so much. I'm honored to be here.
Yeah, so let's start from the very beginning, Dr. Lin. How did you first get interested in the medical field?
Oh, that started when I was very young in kindergarten. I remember one day somebody brought in hearts for us to look at. So there's a lamb heart and a cow heart. And I thought that was the coolest thing. And then another day they brought lungs. There was a healthy lung and smoker's lung. And I also thought that was the coolest thing. And so that was kind of, I mean, I didn't know it quite yet, but I wanted to go into healthcare. I wanted to help people. I was just so interested in anatomy and the human body.
Okay. And so what led you to ultimately decide to transition over to dental?
Yes. So in college, I joined the Pre-Dental Society, which was great because it gave me hands-on experience. I became a clinic manager for the student-run free dental clinics. I learned how to take x-rays, Elgin impressions. I assisted dentists with procedures and made sure that the clinics were stocked and scheduled and things like that. So that was when I fell in love with dentistry. And I'm really lucky, I know, because sometimes people don't get that experience hands-on. And that was when I was like, okay, I really like dentistry. And I didn't realize that there was something called oral surgery where you could do surgery and dentistry together. So when I met an oral surgeon, even then it didn't quite click because I kind of thought, I don't know if I could do it. It's going to be a hard road. Like, am I smart enough? It's going to be, so much work. But it's definitely where my passion is.
Got it. Okay. And that led you to eventually start your own practice, Elevate Oral Surgery Group. So what led you to decide to start your own practice?
Well, that was actually part of my decision when I wanted to become a dentist. I liked that you could be your own boss. And then life kind of got in the way, I guess you could say. I had a kid and I was like, oh, well, maybe I'll just be an associate because then I can have a better work-life balance. And then I got a little tired of being an associate after 7 years. And so I traded the headaches of being an associate for the headaches of being an owner. but it's been worth it. Like it all kind of came full circle, I got into dentistry thinking I could be my own boss and then kind of got away from it. But then now I'm my own boss and it's been great.
Got it. Okay. Now, I want to dive into some of the treatments that you provide because you do dentistry, kind of like the broad sense of dentistry, but then oral surgery specifically. So
Yes.
what does an oral surgeon do for like the average person? It's like you do oral surgery. Okay, what is that
What does that
involved?
mean?
Yeah,
Yes.
what does that mean? Because it's not your teeth cleaning anymore necessarily. So like, what does an
Right.
oral surgeon do?
Yes, so I actually can't even do cleanings anymore. I can't do restorative dentistry. Like my scope is now like I can only do oral surgery. So what that means for the normal person is like sedation, extractions, bone grafts, wisdom teeth, dental implants, biopsies. I can treat TMD, temporomandibular joint disorder, non-surgically. I don't do TMJ surgery, but there are oral surgeons that do TMJ surgery. So I did a residency which was 4 years long. There are some oral surgery residencies that are 6 years long, and they get an MD as well. And then after that residency, you can also do a fellowship in TMJ surgery, head and neck cancer surgery, cosmetic surgery. Like these people are like, they've subspecialized so much. But I'm your regular like private practice oral surgeon doing wisdom teeth, dental implants, bone grafts, extractions, biopsies, sedation, nitrous, things like that.
Okay, got it. Now I want to dive into the biopsy because I think some people may have heard of what biopsies are, but I mean, even for myself, I've heard the name, but I don't know what it really is. What is a biopsy?
Yes, so biopsy. So if you have something in your mouth that has not healed after 2 weeks, you should probably see an oral surgeon. You might need a biopsy because usually lesions in the mouth will heal after 2 weeks if it's just from trauma. If it's not healing after 2 weeks, that could be an issue. So the only way to really diagnose a lesion in the mouth is by doing a biopsy, which is taking a sample of tissue and sending it to a pathologist so that a pathologist can look at it under a microscope. And the biopsy might be removing the whole lesion, which is an excisional biopsy, or it might be removing just a piece of it, which is an incisional biopsy. And it just kind of depends on the size and location for which one we do. And that's how we diagnose things.
Okay. So with the biopsy, then, are you doing the part where it's just the taking it out and then giving someone to diagnose? Or are you also doing the treatment that, hey, we got this, okay, it's a tumor, it's cancer, it's whatever, it's bad. We need to remove it. So then you go back in afterwards and then completely remove it as well.
That's a great question. So it could be either. It depends on what it is. So if it's something that's not cancer, or even if it's cancer and it's small enough, I might be able to provide the definitive treatment. But in general, if I see something, and I can't diagnose cancer just by looking at it, but if I see something that's highly suspicious for cancer, I will call a head and neck cancer trained oral surgeon or ENT and say, hey, I have this patient. Can you see them right away? Because it's better for someone who can do the definitive treatment to start with the biopsy. Because that's just what we learned in residency. Sometimes we would get people sending patients over to us that have already done the biopsy, and then we get the scarred up leftover tissue. And so we're like, oh, we wish we could have started this from the beginning, because we did a lot of head and neck cancer in residency as well. But yeah, so if I see something highly suspicious for cancer, I'll send it to someone else right away who can do the definitive treatment. But if it's not highly suspicious for cancer, then I'll do the biopsy, find out what it is, and then we'll talk about treatment after that.
Got it. Okay. Now you also do something called expose and bond. What is that?
So that is in conjunction with an orthodontist. So sometimes people will have teeth that just have not come down into the arch, and they need a little suggestion. So what that means is I open up the area, I place a bracket on there, just like any orthodontic bracket, but it has a gold chain on it. And I'll put that bracket on, I'll send them back to the orthodontist, and the orthodontist will use that chain to gradually pull it into the arch. So that takes like months of time. Once in a while, that tooth is actually ankylosed, which means it's fused to the bone and it just won't budge. And we don't know that until after we try it. So I do tell patients, we try the expose and bond. It's more effective in younger patients. We usually expect it to come down, but once in a while it's ankylosed. It's more likely to be ankylosed in older patients, in which case we end up having to extract the tooth, and then either the orthodontist will pull everything in, or we'll put a bone graft and an implant in instead.
Okay. So you basically have this gold chain hanging from your tooth for a couple months.
Yeah, it's attached to the wire, the orthodontic.
Oh, okay. Try to like visualize this one. He's got this like gold chain just hanging out there.
No, I'll usually secure it to the orthodontic wire, or if there's no wire, then I'll bond it to the tooth next door, so it's not just like hanging out.
Yeah. Okay. Got it. Now, wisdom teeth. I know a lot of people know about wisdom teeth. Would you say that everyone does need to get their wisdom teeth pulled at some time, or is it just going to be very specific, like, hey, come get it checked, and if you can remove it, yes, but otherwise you may not need to?
Not everybody needs their wisdom teeth removed. So it's important to see your general dentist. Usually they're the ones that will say, oh, or your pediatric dentist. They're the ones that will kind of gauge the growth of the patient and see if maybe those teeth need to be extracted. And then they'll send them to the oral surgeon. And I'll take a look. And if it looks like there's not enough space for the wisdom teeth, like the jaws just aren't big enough, then we should remove the wisdom teeth. But if it looks like the teeth have come out into the arch, like they're fully erupted, the patient can floss behind the wisdom teeth and keep everything clean, then they can keep the wisdom teeth. Or if they're over 40 and the wisdom teeth are still completely covered by bone, then we leave it alone. We don't go after those.
Okay. So typically, if you are going to get it removed, you usually do it when they're younger.
Yes, before the age of 25 is optimal because after 25, the bone hardens, the roots of the teeth are fully formed, and there's something called the inferior alveolar nerve in the middle of the lower jawbone, and the roots of the tooth can form in a way that wraps around that nerve. And so we try to extract the teeth before that happens.
Got it. Okay. Now, Dr. Lin, I'm sure that you've gotten a lot of patients or people talking about common misconceptions or myths about some of these treatments that you provide. What would you say some of the most common myths or misconceptions that you've heard from your patients?
For wisdom teeth, it's always like, well, they've never bothered me. Why do I need them out? And a lot of the time, people need them out because they don't feel symptoms, but there is something wrong, but they don't see it. And I try to explain it in the x-ray, and I wish I had an x-ray to show you right now, but you can see kind of the bone is intact or not intact in the area of the wisdom tooth. So if the wisdom tooth has come out just enough to where it's kind of broken out of the bone, that means that bacteria can get under the gums and to the wisdom tooth and cause decay, even though the tooth is still mostly covered by bone. And so that's a reason to remove the wisdom teeth because bacteria can get there and cause decay. I have taken out decayed, impacted wisdom teeth on 80-year-olds before, and that's just not as fun for the patient. I mean, it's easier when you're younger and healthier to recover from these types of surgeries. So
okay. So it's mostly about decay then, because I've also kind of heard, I don't know if this is also a myth, but if you leave the wisdom teeth in, it can kind of keep growing in and pushing your teeth together, or is that a myth?
That's a great question. There have been no studies to prove that because it's hard to do a study like that. Like you can't be like, I'm going to take out your wisdom teeth, but not your wisdom teeth, and then follow you for life and see if you start to crowd. Like it's hard to follow that.
Yeah.
Anecdotally, people feel like the wisdom teeth are pushing their teeth and causing crowding, but no one can actually scientifically prove it.
So it's mostly just a decay issue then.
It's decay, infection. You could also have cyst formation. There's something called a dentigerous cyst that can form on wisdom teeth if you don't remove them. And deep periodontal pockets. So this is actually a big one. The second molar in front of the wisdom tooth can form a deep pocket. And then you get bone loss and periodontal disease in that area. And then you can also get decay on both teeth. So I've also taken out the second molar and the wisdom tooth because they're both decayed.
Okay. Got it.
So decay is a big one, but there are some other reasons that you'd want to remove the wisdom teeth.
Okay. So make sure you check with your general dentist first. Do you really need that or not?
Yeah.
Okay.
There are some patients who come straight to me who just don't have a dental home because not everybody goes to the dentist, even though they should. And then they find me online because they're like, oh, I have this tooth that's hurting, or I have this really decayed tooth and I think I need it out. So there are some people who come and find me directly. And then I will tell them like, hey, you should find a dentist and just go see them regularly so we catch these things before they become a big problem.
Okay. Now, Dr. Lin, you've been on some humanitarian missions. What would you do on these humanitarian missions?
Yes. So my first humanitarian missions were with the Pre-Dental Society. So I wasn't even in dental school yet. And they had me do patient triage and assisting. And at some point, they actually taught me how to numb patients and take out teeth. So that was kind of another experience, a life experience that made me feel like, yes, I want to be an oral surgeon because I love
Hmm.
taking out teeth.
Hmm.
But, um, yeah, so we would pack up our instruments in our cold sterile, and we would either go to like a school or a church or just any space that they've coordinated with the locals for us to set up. The most interesting space we set up in was in the jungle of the Marshall Islands and Papua New Guinea, because I actually went with the US Navy on some humanitarian missions. So we flew on helicopters into the jungle, landed, brought our chairs and our cold sterile and tables and set up. And I don't know how these people knew our coordinates. Like people were just coming through the trees like to see us so that we could take out their teeth. And I'm just like, how do they even know where to go? Like it just looks like trees everywhere.
Okay. And now within your specialization, representation seems to kind of be an issue. I believe that females in your specialty is only maybe 8 to 10% of all
Correct.
people in your specialty is females. Um, what is being done to try and get more female representation in your specialty?
I don't really know what's being done, but I do see more females entering oral and maxillofacial surgery, which is great. I was the third female to graduate from UCSF Fresno oral and maxillofacial surgery residency, so I'm very proud of that.
Mhm.
But and since my graduation, there's always been, I think, at least one female in the following classes. And so I'm not exactly sure what's being done proactively. I just don't know that, but I do see like there's a trend of more females. So that's great.
Okay, well, that's good. I guess you need to, as long as more and more people are following in those footsteps, it's a good way to get the representation up.
Yes, and actually, let me amend that answer a little bit because I'm also on social media, especially being an entrepreneur and a practice owner. Social media is like a big thing.
Mhm.
So, and I follow some other female oral surgeons. So I feel like that's also very important is that we as female oral surgeons get out there and represent ourselves.
Mhm. That's important. You got to get your name out there.
Yeah.
Okay, now, Dr. Lin, let's say that somebody is looking for an oral surgeon. They need help, their teeth is hurting, or they just something's come up. What important advice would you give to this person when they're looking for an oral surgeon so they can find the person who has that knowledge, has that experience, and can basically help them get the end result they're looking for?
Yeah, that's a great question. So oral surgeons go through a lot of training. Each program is different, but I think as long as you find an oral surgeon that is specialty trained, there are some general dentists that kind of call themselves oral surgeons without actually going through residency. So, I mean, I would just check out their bio and make sure they actually went through residency.
Mhm.
I think that's kind of step one. But step two is just finding someone that you feel comfortable with. Because sometimes finding the right doctor is also finding someone that you feel like you can talk to, that you can trust. So that's a big one. Um, I think those are kind of the top two.
Okay. Now, Dr. Lin, I'm sure that throughout your experience, you've had some challenging cases or memorable cases that you've worked on. Is there any story that comes to mind that you're able to share of one of those memorable cases you worked on and ultimately how you were able to get them a great outcome in the end?
Yes. So this happened while I was in general practice residency in Brooklyn, New York at Lutheran Medical Center. I finished dental school by then. So this was kind of like a hospital-based residency before I did oral surgery, formal oral surgery. Although in this residency, I kind of acted like the oral surgery resident because they didn't have oral surgery residents. So we took the place. And there was a patient that we nicknamed the subway surfer. So as you can imagine, jumped on top of the subway and decided to surf it, but didn't think about the tunnels.
Ooh.
And so he was just a complete face smush.
Mhm.
And so, yes, so when he was in surgery, we, did what we could to put the bones back where we thought they should go. But they were very comminuted fractures. Comminuted means that they just like shattered into
Mhm.
little pieces.
Mhm.
So there were some parts where we're like, well, we think this matches, so and we just did our best. Um, that maybe was not the most optimal, um, the most optimal, sorry, I'm losing the word, result. Yeah, that may have
Mm-hmm.
not been the most optimal result, but we did our best with what we had
Yeah.
because it was just such a comminuted fracture. It was so many little pieces of bone in different places. We at least got his eyes even,
Mm-hmm.
so that was important. We at least got his forehead looking like it had a good contour.
Mm-hmm.
We at least got his nose as straight as we could. He also had some zygomatic fractures, so his
Mm-hmm.
cheeks, we tried to make everything as symmetrical as possible. The jaw fracture was a little bit easier because it wasn't so comminuted.
Mm-hmm.
Um, Luckily, his teeth were intact, so
Mm-hmm.
we could kind of use that as like a working, a point of reference to work from.
Mm-hmm.
Because if we could get the teeth together and the joints in the right place, then everything else should fall in line.
Mm-hmm.
But it was just tough because of all the little pieces.
Yeah, it's amazing you even survived.
Right. Yes.
Well, I can see how that's very memorable, man.
Yes.
Okay. Well, Dr. Lin, where do you think the future of dentistry and oral surgery is going?
It's a great question. I'm hoping that it stays in a lot of private practice settings, and I'm hoping that patients understand that, we care. We try to provide options that are the best for the patients. And I'm hoping that insurance companies don't try to take a seat at the table when deciding what's right for the patient. But unfortunately, that's already sort of happening because patients think that if it's not covered, then they don't need it.
Mm-hmm.
But that's not always true. Insurances are more of a discount plan. But yeah, so I'm hoping that the future of oral surgery is keeping it true to what is best for the patient.
Got it. Okay. Well, Dr. Lin, I do have one last question for you, but before I ask it, I do want to point people to your website at elevateoralsurgerygroup.com. Now,
Okay.
last question for you. What does beauty mean to you?
Oh, beauty.
Mhm.
It's a very deep question because I think, like you said, there's inner beauty, there's outward beauty, there's happiness, there's peace, and I feel like that all kind of plays a role in beauty. Confidence, sometimes a smile is part of beauty, and we are here to elevate your smile. But I think it's a lot of things. That's a very, very deep question. But beauty to me, I think, is feeling comfortable with yourself and and happy with yourself and happy with life.
Okay. Well, there you have it. Dr. Lin sharing her expertise. Now, Dr. Lin, where can people contact you in your practice?
People can contact me at info@elevateoralsurgerygroup.com, or they can call our office. It's 919-488-2194.
Okay, awesome. Well, Dr. Lin, this was great. Thank you for coming on. Thank you for sharing your knowledge, and thanks for sharing your message.
Thank you so much for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.